Hi, welcome to the Dog Dave Show. Thank you so much for joining us today. On this show, as you are aware, that we bring health professionals to talk about what they are passionate about doing. We bring specialist doctors, we bring other health professionals as well who are involved in looking after the patients. It doesn't matter who you see, the ultimate goal is for the patient to be better. Not only do we bring health professionals, we also talk about social issues. We also talk about business and motivation on the show. Now today on the show, we are going to sideline a bit. We are going to bring in somebody who is very passionate about complementary medicine. In particular, we're talking about hypnotherapy. I've got a few patients of mine who've confessed to me that hypnotherapy does work for weight loss, and they actually say they've lost 2 or 3 kilos in just going through the therapy. So I thought, I became so passionate, I became so enthusiastic to know what it is. So I managed to grab a guy who has been doing this for a long, long time, and he's agreed to come to the show to explain what's hypnotherapy, what does it entail. And also he's going to demonstrate for the sake of everybody else who is keen to know what it is. His name is Jeffrey Mack. Jeffrey Mack is a hypnotherapist. Jeffrey Mack, thank you so much for coming to the show. Appreciate coming. Yeah, thank you. Wow, that's good. So we're talking about hypnotherapy today. It's part of the complementary medicine, right? Yeah. I was reading through hypnotherapy. You can do it. You can use it for many ailments.
Yeah, that's
We
correct.
can use it for anxiety disorders. You can use post-traumatic stress disorder. You can use it for smoking cessation. It's very popular with smoking cessation.
Yes, it is.
And you can use it for phobias and a lot of other things like depression as well. But what pushed me forward for me to find you is the application of hypnotherapy in terms of weight loss, because I got quite a chunk of patients who are struggling with weight. And they try all the diet, they do the exercise, low calories and everything else. Sometimes they don't go anywhere at all. And yet some say they got a good response from hypnotherapy. And I became so very enthusiastic about it. I said, let me look for somebody who can talk about it, because not many people know what hypnotherapy is. So let's start from the basics. What is hypnotherapy? What is it for the sake of the layman who are watching now?
Basically, changing behaviours and current beliefs.
Yep.
When it comes to weight loss, there's a lot of aspects involved with people, their eating, whether it be emotional, diet, lifestyle, lack of exercise from sitting around.
Yep.
So with the hypnotherapy, you can go at it in from a lot of angles, I guess. So you're dealing with the emotional issues, you're changing the food behaviours, are you making healthier choices, things like drinking more water, exercise motivation if the person wants it or needs it, and most importantly dealing with those emotional issues that drive the behaviours. With the application of hypnotherapy, of course, we're using it to change all those behaviours, but the concept has also come about to use a gastric band on the person, having them actually believe that they have a gastric band in place so that they can only eat a small amount of food at any one time. And basically works just like the operation.
So we'll come to that gastric band for weight loss. We call it virtual gastric band. It's not like a surgical procedure. We'll talk about it in more detail. But I'll push you back and say, when hypnotherapy started, there was controversy regarding hypnotherapy and psychological interventions. Now there's a general acceptance that hypnotherapy does work. I was looking at the American Association of Psychologists. They now say 85% of people have found hypnotherapy very effective. It's an effective therapeutic method for some patients, obviously. It doesn't work for everybody.
No.
Now, if you're saying you're going to change the behaviors of a person, the way they perceive themselves, the way their dietary habits and the exercise, isn't it the same thing like psychological therapy? Where do we cut off the line here?
It's, I guess, because of the hypnotic state, you're just offering up suggestions to make better choices, and the unconscious will only take on suggestions that are pleasing to it. So you're actually getting this person to do something that they want to do. A lot of times you have to take care of the drivers behind it. There's a secondary gain involved in the behaviour. Overeating sweets, that kind of thing, when they're stressed, upset, a lot of people turn to food. I mean, you can feel bad, eat something and still have bad feelings. So it doesn't take it away. And on top of that, then they start to feel guilty.
Yes, okay. So you're talking about the conscious and the unconscious mind.
Yeah.
So the unconscious mind, is that where their behaviors are? Let's say I'm scared of cockroaches, or let's say spiders. Where is that sitting?
Behaviors are something that people do.
Yeah.
Okay, so there's an actual mental process to them doing that behavior. And I guess the idea of it is to get them to do something else that is more positive if they're having a negative reaction. So when it comes to things like a phobia with cockroaches, generally it's a visual thing, maybe a feeling thing with, probably green frogs are a prime example for phobias, because most people that I've seen that have had a green frog phobia, someone has thrown a green frog on them at some point in their life.
Okay.
And so they see the green frog, instantly they remember the feeling of that cold, wet frog. The frog's going to jump on me, they start catastrophizing, and that's how they're doing their phobia or their behavior.
Yeah. So when you do the technique yourself, what? I mean, you need to take away distractions. I was reading, you have to take away distractions, and they go into this, tapping into that unconscious mind. Is that the whole point? They become calmer?
It's actually a heightened state of awareness.
Yeah.
A very concentrated, focused state of attention. Best way I can describe it personally is a very inward, downward kind of feeling. So you're not too concerned about things that are going on around you. It's a very focused attention. And then I guess you still have conscious thoughts, but it overrides that critical part of your mind that wants to question everything. Oh, is that right? Is that wrong? That's why with the stage show they can get someone to eat an onion and tell them it's an apple. They look at it, they can see it's an onion, but it's not registering in their brain. So that then, just the sheer fact that you can do those kind of things makes it very effective for like putting gastric bands on, getting the taste of cigarettes smoke in a person's mouth in order to help them quit smoking, having cravings fade away, all those kind of things.
Okay, so I mean, there's hypnotherapy association in Australia. That's right.
Yeah, there's a few of them. Yeah, I'm a member of the Australian Hypnotherapy Association.
Yes. And you are part of that organisation, are you?
Yeah. So we have to continue doing our professional development to stay current and have health funds. Look at us. So
you got the conduct of behaviours and professionalism. Everything is tabulated. Everybody has got to subscribe to that. Is that right?
That's right.
In the training, how was it? How stringent is the training?
Well, a lot of training these days, it's just done at your own pace. Depending on the institution that you train with, as to how long their training is. I was lucky enough to train with a couple of the best in Australia. So I learnt the right way the first time, basically. But a 3 weeks of full time. Practical, and then there was a lot of study to go along with it. Most of the stuff you learn as you go, because I think out of the thousands of people I've seen, there might be one or two textbook cases. You know, you learn so much on the job, different things happen, people have different reactions. If something's not working, you can't just continually try and do the same thing with that person.
You want to try something different, What made you do hypnotherapy? What was the driving factor behind that?
I actually looked into it for self-hypnosis, for sports performance. And I was a personal trainer at the time. And when I looked up self-hypnosis, I found this course popped up. And I thought, oh, that's very interesting. But I don't want that. I want to know how to do hypnosis on myself. And then I got another email. So it was one of those cases where I was kind of, oh, that just looks like it's the right thing for me. Always been very interested. I've done a few other types of natural therapy training, but it just didn't fit with me. And I found that this was just right.
That's very good. Are you busy at all?
Yeah.
Very busy?
Yeah, you're as busy as you want to be. It's a good lifestyle. Good lifestyle business. I work and live at the same place, so it's even better.
And how do people find you?
I advertise on Facebook.
Yeah,
professionally advertise on Facebook.
And do you get referrals from doctors and other practitioners? 2
psychologists that I do, and some doctors do.
They do.
Yourself.
So there's acceptability of your profession.
It's becoming more recognised, and I think at the moment the AHA is working with other organisations to get all the hypnotherapy associations under one umbrella so that it can be taken a bit more seriously, I guess, when the government recognises it as one body.
Right.
Yeah.
That's good, that's good. And today you are going to demonstrate for the sake of viewers how you're going to use a technique on the lady here, and the purpose here is to lose weight, is that right?
That's correct, yeah.
Yeah, and you've done hypnotherapy on her before.
Yeah, that's correct. So what we're actually going to do today, rather than taking her through, or someone through a banding operation, we're just going to treat it like a visit to her surgeon for a post-operative checkup, where he'll do an adjustment using the valve that was put in place during the surgery.
Right, yeah.
So our subject will see the image in her mind, and she will actually feel the tightness when we do it, and we'll get her to signal that she can feel that.
How was it? I mean, how was it before? Because this is second time you're doing this on this lady, is that correct?
Yeah, well, it's only just like once it's been done, it can always just be treated like as if you had the real band, and you can go back for an adjustment. Unfortunately, we don't have any control over life circumstances, those kind of things.
Things change.
So if you have major things going on in your life, then it can, of course, you know,
happens with
upset
everybody.
things a little bit, where you might start to do some behaviours for a little while. And
that's okay. So people come for touch-ups, if you can call them touch-ups.
Not often, but they do.
Yeah, they do. Yeah, okay.
Yeah, you know, if they think that they're starting to deviate from how well they've been going, you know, they might ring up and...
Do you have to teach them techniques they have to carry on doing on their own? No.
I don't believe in doing that. I don't do recordings for people to listen to, because as far as I'm concerned, we do the work there and then.
Yeah, okay.
And I want to know that there's some change going on.
Yeah. And how much on average have you had in terms of weight loss? How much on average, how many kgs lost in terms? After a few sessions?
Generally, people will lose anywhere from 1 kilo to 3 kilos in their first week. I'm extremely happy if someone consistently loses half a kilo a week.
Right.
Because that's 2 kilos a month they weren't losing. It's all about changing the behaviours.
Yes.
So they're not on a diet.
They're not on a diet.
Nope, they're not on a diet.
They don't need to go to the gym and do all that stuff.
If they don't want to, they don't have to. I mean, you know, it's all about changing the behaviours that are causing the problem.
Yeah, maybe I'm in as well, so I don't have to go to the gym.
And then making sure that they're emotionally stable.
Right, okay.
So they're not inclined to do it.
Yeah, okay.
But then once, if, like you say, if it can be just treated as a checkup with a surgeon from there on.
So how many sessions in total do they need to undergo?
Generally we do 4. Occasionally I'll have people that are going so well that they get a bit worried that, I've never gone this good before for this long. I just ask them to come back in a month or so. I don't charge them, come back and we'll just check on you, make sure you're going okay.
And each session is how long?
Up to an hour.
Up to an hour?
Yeah.
Okay. Yeah. And how far apart are the sessions?
Well, generally I like to do a week between the first 2 because we put the band on in that first session, and then it gives us a week to see how the person has gone. If their meal sizes are smaller but need to be smaller, we're getting on top of things before they get out of hand, and then we go to 2 weeks apart after that. I have done it successfully with people that have had a month break because they work in Western Australia. Things like internet, that kind of thing, phone, I wouldn't do it with someone. I'd rather have them there where we can see what's going on.
So most of your clients do happen to be men or females?
I get a pretty mixed bag of both, yeah. And I get all kinds of problems, all kinds of issues, but most of them are just emotionally driven problems. And so, like, if you get someone that wants to come along and they want to stop drinking, I mean, smoking's probably one of the only ones where you really go after the behaviour and the cravings and things like that. I do emotional stuff in that as well. But most of your other issues, if someone, say, came because they drink too much, their first session I wouldn't even mention drinking. We're looking at what emotional drivers they've got there. And do those first, because that's what's driving the problem. It's not a case of coming in, you won't drink anymore. It's not that easy. Yeah, because I mean, a lot of people see those shows, the stage shows and you got, you know, the next time you open your eyes, you're going to be an alien and you're going to be the interpreter and they're bloop, bloop, bloop between each other. That's all good for a bit of fun, but it's not a behavioural change.
Do you work in conjunction with other therapeutic interventions, let's say ordered by psychologists, or do you work together? Do you ask if your patient, are you undergoing through another intervention with a psychologist or a doctor?
Yeah.
Do you work alongside in conjunction?
We don't generally work alongside one another. I do ask people if they've sought help for this problem before. Most of the time, by the time I get them, they've been everywhere else. And then they're expecting hypnotherapy to work just like that, which puts a little bit of pressure on things sometimes. But I'm just starting to work with a couple of psychologists. One of them will probably be working alongside together a lot more, discussing patients and how we can, you know, combine the two to help. Yeah. Yeah, we'll have a sit down with each other once a fortnight or once a week, once a month, whatever we find, and we can work out ways we can incorporate the two to.
All right, so we appreciate that you're going to demonstrate for the sake of the viewers.
Yeah, sure.
And say, hey, what is this? You know, it's scary. You know, what does it tell? So you are going to demonstrate. I mean, in as simple way as possible. For the sake of the viewers.
Sure.
Right?
Yep.
Okay, look forward to it. We don't have to say anything. We don't have to do anything. We don't have. You clap hands or anything?
No.
No, you just leave.
No, not unless you want to join in.
You lead the show.
Not unless you want to join in.
Now Jeffrey is going to demonstrate to us how he does the technique. This time around where he's going to target weight loss. So he's going to do the visual gastric band for weight loss.
That's correct.
Okay, Jeffrey, you take over the show.
So basically what we're going to do is an adjustment on an existing band, just to give people an idea.
Yeah, just to what's a band? What's a band?
The gastric band.
Yeah.
So Trina's had a virtual gastric band fitted by me in the past. So today we're just going to do like a check-up with her surgeon, where he does an adjustment on the band, and a demonstration of how she will feel the tightness, see the image in her mind.
Yeah, so you are the surgeon. You are the surgeon, or are you the surgeon yourself?
No, I just talk as if he's there. Yeah.
Ah, okay, all right. Yeah. Go ahead, please.
Okay, so Trina, just looking up towards your eyebrows for me. So your eyes are slightly strained. Take a nice deep breath. Hold your gaze up there. Just exhale. Take another nice deep breath. That's right. Just one last time. And just allow your eyes to close as you let that one go. I want you to imagine you have a thin line of super sticky, super strong super glue along your eyelids, sticking them shut. You imagining that? Go ahead, test them, make sure they're stuck. That's right, good. Now I want you to imagine from this point forward that each time you attempt to open those eyes, each time you try to open those eyes, they become more tightly stuck. Imagine that. Go ahead, try and open them. Good. Just relax those eyes, take a nice deep breath. In a moment I'm going to count from 1 to 3. When I get to 3, your eyes will open, but just for a moment. As I snap my fingers and say the word sleep, your eyes will close. You will not fall asleep, you will not go to sleep, you will simply allow yourself to go into a very relaxed state of focused attention, concentrated relaxation, relaxing every muscle, every nerve, every fibre. 1, 2, 3. Sleep. Close those eyes, going deeper. Deeper, deeper relax. That's right. Just continuing to relax more deeply, more completely. That's right. Every sound that you hear, the sound of my voice, just allowing you to relax more deeply, more completely. And this hand can come down with honest, unconscious movements as you drift deeper and deeper and deeper relax. That's right. So the deeper you go, the more you relax. The more you relax, the deeper you go. The deeper you go, the better you feel. That's right. That's right, good. All the way down inside. It's just like a daydream again, and all you have to do is let my voice, the sounds, the words wash over you and through you. You might not remember everything consciously afterwards, as you simply find yourself comfortable with the changes that you are noticing. And there have been changes, some subtle changes and some more obvious changes that you started to notice first as these new ways of thinking have become a part of who you are, how you behave, how you are, and how you live. And you want to achieve your goals, You're fully committed to achieving your goals. It feels great to be on the right path with your vertebral gastric band fitted. So relax and listen to my words. And I'd like you to use your imagination for me. I want you to imagine or just get a sense or a feeling that you're in your surgeon's consulting room. It's that same safe, enjoyable place that you visited before. And while you're waiting for the surgeon, do think again of those most important reasons to you for becoming slimmer, healthier. Perhaps you enjoy more energy, better health. I want you to think what those most important reasons are. When your surgeon comes in and you feel fully at ease within his presence, he asks you to lie down on the consulting bed and just relax even more as he asks you to close your eyes and tell him how you are going. Paying particular attention to telling him all those positive things that you have been noticing. And of course any of those negative things as well. He then tells you that he's going to check your band and adjust it so that you can continue to enjoy those smaller portion sizes, continue to feel full more easily and for a longer period of time, so you can just relax even more. As he dabs a bit of analgesic onto your stomach, it feels cool, it feels nice. And immediately you notice that he's putting pressure on your stomach. And even right now, you know how your stomach feels. You know whether your stomach feels slightly hungry, comfortable, full. You know just how your stomach feels. So just feel that tightness beginning. So just feel that tightness beginning as he adjusts that band to the perfect size of a golf ball. Just feel that tightness beginning. If you can't, that's fine. Just imagine you can feel that tightness beginning. And when you can feel that tightness beginning, just nod your head so that I know. Just feel that tightness beginning. When you can feel that tightness beginning, just nod your head so that I know. Good. Now this tightness will continue to just the right amount. That will significantly reduce the feelings of your stomach size so that you can only eat a small amount of food at any one time. So that you can only eat the appropriate amount of calories each day that will have you lose all the weight you want easily and safely. However, you will notice the tightness around your stomach. From now on, you will notice that tightness around your stomach. And when you come out of hypnosis, you will feel especially tight if you ignore your reduced appetite and eat more than your reduced stomach can comfortably manage. Your mind and body will absolutely know, and you will want to eat less immediately. From now on, you know that your stomach size is much reduced and you will need much, much less food at once to feel full. Just relax, he's nearly done. Good, he's done. He's used that valve that was put in place during the surgery to ensure that your band is functioning perfectly, and it is. So you will feel those feelings of fullness even more clearly now and feel even more in control as your mind and body tell you even more clearly now when your stomach feels full. Now every day and every way your life is getting better and better. You now feel very confident and very, very positive that you're going to lose this excess weight and keep it off. Now you've got a gastric band fitted. You're making healthier choices, eating smaller amounts of food, drinking plenty of fresh, clean water throughout the day. So it just becomes a process of losing weight in a steady, safe, consistent way, in a safe, controlled and timely fashion. And when you wake up, you'll feel very, very proud of yourself and very excited about losing the weight. You're going to eat very, very slowly, just small amounts, and you will feel very full very quickly. And your mind and body will remind you in a very powerful and immediate way that your stomach simply cannot take in as much food as it used to. Now your mind and body have accepted this procedure and all of these instructions. So just take a nice deep breath, relax and exhale, and nod your head gently to yourself in agreement that this is now the way that it is. Good. Now whenever you're ready, when you come out of hypnosis, you will act upon all suggestions fully, totally and completely. So when you feel that your unconscious mind has fully integrated all these suggestions and changes in such a way but they will be naturally and spontaneously available to you. Your everyday waking conscious, all areas of your life as if they've always been there. You can slowly come back into the room, back to full waking consciousness, feeling refreshed and alert with a smile on your face and ready to get on with the rest of your day. Welcome back.
What can I say? What can I say? How do you feel?
Fine.
You feel fine?
Good.
It was like riding a bike, wasn't it?
Yeah, it was.
So when he's talking to you, he's taking you far, far, far back into your mind, isn't it?
It is, yes. I'm very aware of his voice, and his voice only, and it seems to reach deep in to
Right.
talk to me,
Yeah.
you know, and only me.
And only you.
Yeah.
So you feel like you're just the two of you?
Yes, but I'm still, basically, I can hear movement around. I can sense things moving around me, but I'm wholly and solely concentrating and listening freely to what he's saying.
Yeah. So when he's saying the surgeon is tightening the band, what do you feel?
I could feel my stomach, and I could feel around where my stomach comes down and where the narrowest part is. And I could feel it just getting tighter, and I could feel all up there just getting tighter.
Right.
And flatter.
And flatter.
And to flatter, yes.
And flatter too.
Yeah.
All right. That's interesting. Wow. So in the past you've had a few sessions with Jeffrey, right?
Yes, I have.
Yeah. And you've lost weight.
Yes.
And now you're here for more therapies, obviously. Yeah. Yeah. Which is okay. You found it very effective?
I found it very effective. I
Yeah.
lost 10 kilos initially when I did it with Jeff.
3 months?
3 months it
Yeah.
took, yes.
10 kilos
10
in 3 months.
kilos. And I haven't put that weight back on.
Wow.
And in that 12 months, I have found that I drink a lot of water, which
Right.
water was one of those nasty things to me before.
Right.
I now drink anything up to 3 litres a day. My food sizes are smaller.
Mm-hmm.
My health choices, as in food, is a lot better.
Right.
And then I do find, like a real band, if I eat the wrong things,
Yes.
his husband might have disappeared
Yes.
for a day or two, so I feel I can have a little treat.
Right.
I pay for it the next day, just like I do with a real band, because your body is rejecting that fat. And I find now to drink or eat food that is very sweet, because I've got so used to going without all the sugars and so forth and the preservatives and everything, I find I don't want them.
Right.
You know, I'll go for an apple over a chip.
Right. What made you come for hypnotherapy?
I've had, since 2011, I've had different viruses, I've had cancer, I've had heart attack, I've had a lot of health issues,
Right.
plus deaths in the family and so forth. So emotionally and medically and physically, I was very, very down, and I was at basically my wit's end. And I'd spoken to my doctor after I'd seen Jeff's thing on Facebook, and I spoke to a couple other people as well to sort of see if it was for real.
Yes.
And my doctor said, yes, go for it, as long as you're open to suggestion. You'll probably find it will help.
That's
And
right.
he was even happy and surprised with the results.
Wow.
So, and my attitude, because it picked me right up.
Oh, that's good. That's good.
So that's the other benefits of it. I mean, I get people that come along, they're overweight, their diet's poor, they've got diabetes.
Yes.
All of a sudden their sugar levels are from back down where they should be within a couple of weeks because of their diet. And of course they go back to see their doctor, and he's over the moon because their level.
He had actually diagnosed me as pre-diabetic just before I'd seen Jeff, and now I don't have
You don't have
So you'd know that yourself, you know, when people come to see you and you know that their diet's poor and everything, and it's a big recommendation, eat more healthy,
Yep.
you know, it's
Yeah, I'm a proponent for alternatives anyway, which is this the alternative therapy to the conventional things we do, psychological therapy, dietitians, and general medicine, obviously. So I really give value to complementary medicine, which is why maybe I had to drag you in here to demonstrate. Yeah, because I believe in these things. So, it's working, whatever works for anybody.
That's exactly
point,
right. I think whatever works for you,
that's
it's not a one size fits all.
That's right. Yeah. So
whatever therapy it does it for you, it's what you believe. It's about changing belief.
Yeah, that's fantastic. I see there's a lot of talking in the process.
A lot of talking. Can be a lot of repetition, a lot of processes, right language to use, as far as suggestions go, that kind of thing.
Yeah. So
you need to be mindful of what you say. The unconscious can be very literal. One thing, two young chaps come to mind. Their mother brought them to see me. They actually live overseas. Their father works overseas. So when they were back in Australia, brought these two 10-year-old twins to see me because they were nail biters.
Right.
That's all fine and good. We did the work on each one of them. Took them through a process each. Stopped biting their nails. Problem being, the process I used, straight out of a book. One part of it was the unconscious willing to use this behaviour for 3 weeks to evaluate its effectiveness. Yes. So what did they do after 3 weeks? Straight away, 3 days, 3 weeks of the day. The unconscious is very literal. So now whenever I use that process, if it is working, are you willing to continue to use it?
Which is the most popular request? You do lots of things. There's another interesting thing you told me. You're also working on erection dysfunction. You're also working on low libido and stuff.
Yeah, with sexual functions with men and women.
Yes.
Of course, quite different ways of going about it with them.
Techniques and stuff.
Generally with women it's an emotional thing.
Yes.
It can be because of trauma with sexual abuse, that kind of stuff.
Yep.
Men it's generally a psychological thing.
Yep.
They've generally been to the GP, doctors and whatever, and they've been tested. It's not a physical thing.
Yes.
So I've actually started to experiment on some interesting concepts there.
Yes.
To help out in that area.
That's very good. That's good. Right. Well, we appreciate you coming to the show. That's good. Jeff, thank you so much for coming to the show.
Thank you very much for having me, Dave.
Yeah, so we always put a disclaimer anyway. Whatever you told the viewers, it's your own personal experience. Of course, there could be some deviations in concepts and stuff. So we always say whatever information you want to get, the first point of contact is your health care provider, a general practitioner or family physician, wherever you are in the world. Talk to your doctor, talk about the options available. If the doctor agrees, doesn't agree, it's up to you personally. You can always contact the hypnotherapists in your area. Self-referrals. For those who want to contact Jeffrey, you can find him on Facebook. That's correct. You haven't got a website, no?
Yep.
You got a website
Facebook
too?
and website, yeah.
Facebook and website.
Hypnosis.
Yeah, that's right. Yeah. So whichever way you take, as long as it works for you, so be it. That's the whole point anyway. So we thank you for joining us on the Doc Dave Show. Always, as usual, we say keep safe where you are and keep well and God bless you. Bye-bye for now.